Welcome to the Jeff Crilly Show. And now, here's Jeff Crilly.
Welcome back to the Jeff Crilly Show. Dr. Albert Pang with Trinity Eye Care in Plano is my guest, and he is seeing a lot more nearsightedness than he's ever seen before. Dr. Pang, welcome to the Jeff Crilly Show.
Thanks for having me this morning. Yes, the answer is certainly not only just the amount of nearsightedness patients I'm seeing, but also the age are getting younger. It seems like we have this epidemic that we are seeing more and more younger patients that are suffering from nearsightedness. They even have statistics in the past 30 years, nearsightedness increased by about 30%.
No kidding. And do you think it is the little devices? I mean, as soon as the baby's born, we almost put an iPad in his or her hands.
I think it's a combination. I think that electronic evolution is one of the reasons. I think it's also the fact that we are adopting more of an indoor culture. Think about when we are growing up, when you and me, we are only 40, right?
Yeah, something like that.
So
35, 30.
So when we are all growing up, during the summertime, we usually just leave the house and then play all day and then come back home for dinner. But nowadays, what happened? The kids are just, during the summertime, they just stay home. And they're looking at the iPad, the computer all day long without exposing to the outdoor. So lifestyle changes together with these electronic devices, lack of outdoor time, I think that's one major reason.
You were explaining to me that the technology emits a blue light, and it's just really not natural for the human eye to look at a screen like that.
Correct. Actually, most of the flat screen devices like iPad, tablet, even like computer screen, and even your flat screen TV, all those artificially emitted a lot of what we call high energy visible blue light. And those high energy visible blue light is not natural for our eyes, for our system. As a matter of fact, exposing too much of those high energy visible light will cause macular degeneration, cataract, and worse yet, disrupt our sleeping pattern. The blue light actually decreases the production of a natural chemical called melatonin. When you reduce your melatonin, you have a harder time to go to sleep. Not only that, but your sleep pattern is also not as deep as the natural sleeping pattern.
So for the advice for parents would be really kind of limit the amount of time that the child is staring at a screen?
Yes, I would say probably the rule of thumb is that if you are having younger children, if they're spending an hours of tablet or phone or computer time, I want to make sure that you also do hours of outdoor time with them. Make sure that they ride their bike, make sure that they play some basketball, make sure they spend some outdoor time, just equal amount of outdoor time with your electronic devices.
Dr. Albert Pang is my guest. He's with Trinity Eye Care. That's trinityeyecare.com. And you are my personal eye doctor, and we've been together now for probably 15 years.
Yeah. Well, you are now giving up your age.
I do have to tell a story, and this is a compliment to you, because I cheated on you one time in 15 years. I went to a big box store that had a vision care center, and I had a person give me a prescription, and I couldn't see anymore. It wasn't done right, and I just could not see. I had to go get grandpa peepers, I think that's what they call them, to see. So my compliment is you really know your stuff. You really know eyes. And I guess what would be your advice to consumers who might want to go save a couple bucks, so you could take the $19 special at some big box store? Is that a mistake?
I think one thing that we have to understand is how precious our eyesight is. One study even say 80% of our learning is actually from our vision. We really have to put perspective into the right place. Yes, we can, probably get a 5-minute examination and then get a prescription. But again, may not be an optimal prescription for you. Yes, we can see, but it's not like seeing critically good as well as what you see. And also the other thing is, do not just only just look at how good you can see, like do I see 20/20? There's more to a eye examination than testing your eyesight. Make sure that you also go to a place that would test your whole vision system. When we talk about that, we are talking about not only just the health of the eye, but also how your two eyes work together. A lot of time I heard patients say, "Hey, why do I have to spend so much time in doing the examination? I can even go online now to do an eye test, right? To get a prescription for 20/20." But vision is beyond 20/20 vision. Vision is a very complex system.
How often should people get their eye checked? And as they age, is it important for them to go more often?
Great question. Usually, before the age of 12, we want to see also the child, once a year, and sometimes more often because of the fact that they may be developing lazy eye, or sometimes the child have a eye that doesn't work together. One eye turn in, one eye turn out. That's what we call strabismus. In those cases, we need to see them even more often because some of them need to have what we call vision training, similar to physical therapy to the eye that they need to do. For patients also above 40, now degenerative conditions like macular degeneration, glaucoma, and cataract tend to come after 40. So after 40, you need to, of course, make sure that you have your eye checked once a year. Now, between the age of 20 to 40, usually the eyes is the prime time, the best time that your health will not be degenerate that much. However, like what we say earlier, if we increase the amount of time in front of the computer and devices, you also want to make sure that you have your eye test.
One of the things that impresses me about your office is you really do a deep dive. I mean, you have several high-tech gadgets. I don't even know what to describe them as, but you're looking at the back of the eye. You're looking at the thinness of my eye. And like the last time we came in, you were calling my attention to this is why you may have some problems in the future if this doesn't improve. What are some of those machines and what do they do?
I think now we are more and more geared towards prevention and discover any eye diseases in a very early stage. We have machine like tomographer machine to measure the actual thickness of the nerve fiber layer. We also have machine that are able to measure the thickness of the cornea, the precise shape of the cornea to make sure that there's no degenerative condition developing. So different than what we have even 10 years ago, we are now geared towards really a lot about preventive medicine. We are even talking about doing genetic testing for the eye so that we were able to predict whether in the future there's a high risk of developing certain kind of eye conditions.
That's fascinating. So really you could like get your mouth swabbed and your DNA strand would tell you something about a person's vision?
Right. Again, it's because of the general program that we have, say, in about 10 years ago, that we are seeing more and more. We have what we call a normal copy of genetic structure versus an abnormal one. When you match the two together, you're able to pick up certain sites of the genetic structure to know whether you're at risk of developing certain eye diseases.
You were just on TV talking about those costume lenses related to Halloween, and I know this is a Halloween show. So that's actually dangerous, huh?
Yes, actually, we just talked about the health risk that we have with using those over-the-counter creepy contact lenses, because three things we have to understand: the dye they put in may not be biocompatible to our eye, causing allergic responses. The condition of the lenses may not be perfect. They may have crack, chips, or imperfection on the lens surface, causing scratching cornea. And also, lastly, the solution that they soak in may not be sterile to the standard that we have. So you may transfer pathogen from the package to the eye, causing severe infection.
Let's talk a little bit about eye strain, because I think, at least I've experienced, my son Dallas, who is also a patient, has had times when he's getting headaches, or he's staring at the computer too much, and it's bothering his eyes. Is that fairly common?
Yes, that's a great question again. It's becoming an epidemic again, because you know what? Human eye is not designed to be a reader or to be a computer operator. Human eyes, when we were created, is more designed as a gatherer and hunter. Our eyes is designed to see far away. If you confine your eye into looking at a computer, into a small screen, then that's where eye strain comes from. So make sure that when you're doing a lot of computer work, have a good visual hygiene by making sure that you take a break in between your close-up work.
We've got about 1 minute left, so let's get into kind of extended wear lenses. I know some of the night and day lenses that I wear. It says you can wear them all night and day, but I take them out every night. I mean, is it smart to swap them out?
Yes, actually, the first time I heard people tell me about, hey, I'm wearing the lenses at the end 30 nights in consecutively, I always give them this analogy. You have a car that can run 200 miles an hour. You don't step on the gas and run 200 miles every day, because you're going to get into trouble. Right. You're going to get into accident. Same thing, you get a good engineering lenses that are safe to use, but you have to be careful about using them.
Dr. Albert Pang, TrinityEyeCare.com. Thanks for being on the Jeff Crilly Show.